Do your feet and ankles feel heavy and swollen at the end of the day? It's a really common issue, especially as we get older. If you spend a lot of time sitting, standing, or traveling, gravity can cause fluid to pool in your lower legs, leading to that uncomfortable puffy feeling we call edema. But the good news is, there are simple, effective things you can do right before bed to help your body drain that excess fluid, so you wake up feeling lighter and more comfortable. So, why does this happen more often after we pass 50? Well, a few things are at play. Our veins have tiny one-way valves that help push blood back up toward the heart. Over time, these valves can become a bit weaker, making it harder for blood to fight gravity. Our circulation might also slow down a little, and changes in our body composition can affect how we manage fluids. Think of it like this. All day long, gravity is pulling fluid down into your feet. If your body's pump isn't as strong as it used to be, that fluid can get stuck. The great news is that you don't just have to live with it. Tonight, you can start using these simple habits to give your body the helping hand it needs. Let's dive into our first bedtime habit, elevating your legs. This is the simplest and one of the most effective things you can do. The goal is to get your feet higher than your heart. This lets gravity work for you, not against you, helping that trapped fluid drain back into your body's circulation. You can use a few pillows stacked under your ankles, or a special wedge pillow designed for leg elevation. Try to keep them elevated for at least 15 to 20 minutes while you're relaxing in bed, maybe while reading a book or watching some TV. Don't put pillows directly under your knees, as that can sometimes bend the leg in a way that restricts blood flow. Focus on supporting your ankles and lower legs. You'll be amazed at how much lighter your legs feel after just a short time. Making this a regular part of your evening routine is a game changer for managing daily swelling. Next up, let's talk about habit number 2, a gentle nighttime foot massage. This isn't just about feeling good. It's a powerful way to manually push fluid out of your foot tissues and improve circulation. You don't need any fancy equipment. Just use a little lotion or oil to help your hands glide smoothly. Start at your toes and use gentle, firm strokes to push upward toward your ankle. Think of it like you're gently squeezing a tube of toothpaste from the bottom up. Pay some attention to the arch of your foot and the area around your ankle. You can use your thumbs to make small circles around the ankle bones. The whole process only needs to take about 5 minutes per foot. It's not only great for reducing swelling, but it's also incredibly relaxing and a perfect way to wind down before sleep. The gentle pressure helps stimulate blood flow and lymphatic drainage, encouraging all that stagnant fluid to get moving again. Now for habit number 3, a technique many therapists use, the warm and cold contrast method. This can feel incredibly soothing and is great for stimulating circulation. Before you get into bed, you can try a contrast foot bath. You'll need 2 basins, one with warm water and one with cool water. Make sure the warm water is comfortable, not hot. Soak your feet in the warm water for about 3 to 5 minutes. This helps to open up the blood vessels. Then, switch to the cool water for about 1 minute. The cool water causes the blood vessels to constrict. By alternating between warm and cool a few times, you create a pumping action in your blood vessels, which is fantastic for moving fluid along and reducing swelling. Always end with the cool water. If you don't want to deal with basins of water, you can achieve a similar effect in the shower by alternating the water temperature on your feet and lower legs. Our 4th habit is a crucial one, and it's all about hydration timing. We all know drinking water is important, but when you drink, it can make a difference, especially if you have swelling. Many people make the mistake of drinking a huge amount of water right before they go to sleep. While staying hydrated helps your body flush out sodium and reduce fluid retention overall, chugging a lot of liquid right before bed can overload your system overnight. The key is to drink plenty of water throughout the day. Sip consistently from morning until early evening. Then, in the 2 to 3 hours before you go to bed, start to taper off. Have a small glass if you're thirsty, but avoid large quantities. This gives your kidneys time to process the fluids before you lie down for a long period, which can help prevent fluid from pooling in your legs and also reduce your chances of having to get up in the middle of the night. Let's move on to habit number 5, simple, light stretching. When your muscles are tight, especially in your calves, it can squeeze the veins and make it harder for fluid to move. A few gentle stretches before bed can release that tension and open up the pathways for better circulation. One of the best stretches is the ankle pump. While you're lying in bed with your legs straight, simply point your toes away from you as far as you can. Hold for a few seconds, and then flex them back toward your shins. Repeat this 10 to 15 times. You can also do ankle circles, slowly rotating your feet clockwise and then counterclockwise. Another great one is a gentle calf stretch. You can use a towel or a resistance band looped around the ball of your foot and gently pull your toes toward you until you feel a light stretch in your calf. These movements act like a mini pump for your lower legs, helping to push fluid upward. Beyond these bedtime habits, what you eat can also play a big role. Some foods are naturally high in potassium, which helps your body balance sodium levels and reduce water retention. Think about adding more bananas, avocados, sweet potatoes, and spinach to your diet. Foods rich in magnesium, like almonds and dark chocolate, can also be beneficial. On the flip side, try to be mindful of your salt intake. Too much sodium, often found in processed foods, canned soups, and fast food, can make your body hold on to extra water, making swelling worse. Cooking more meals at home, where you can control the amount of salt, is a great strategy. Staying well hydrated throughout the day also helps your body flush out excess sodium, so remember that hydration habit we talked about. Finally, it's really important to know when swelling might be a sign of something more serious. While mild, end-of-day swelling in both feet is often benign, you should always talk to your doctor if you experience certain symptoms. Pay attention if the swelling is sudden and severe, if it's only in one leg, or if it's accompanied by pain, redness, or warmth in the affected area. These could be signs of a blood clot, an infection, or another underlying health condition that needs medical attention. Swelling can also be linked to heart, kidney, or liver issues, so if it's a persistent problem, getting a proper diagnosis is key. Think of these bedtime habits as excellent tools for comfort and management, but they are not a substitute for medical advice. Your doctor can help you understand the root cause of your swelling and recommend the best course of action for you. So, to recap, you can start fighting foot swelling tonight by elevating your legs, giving yourself a gentle foot massage, trying a warm cold soak, timing your water intake, and doing a few simple stretches before sleep. These small changes can make a huge difference in how your legs and feet feel in the morning. Thank you so much for watching. I hope you found these tips helpful. Give them a try and let us know how they work for you in the comments below. Don't forget to like this video and subscribe for more health and wellness tips. Here's to waking up with happier feet.